So we have our 9 health expert, Dr. Payal Kohli, here to talk about it. So are we splitting hairs, or is the difference between a homeopathic antiviral treatment and a COVID-19 vaccine significant?
So the difference is obviously very significant, and the problem here comes in the use of the terminology, because immunized by a strict sense by the CDC definition means having immunity through vaccination.
Right.
So technically, yes, he misled the reporters a little bit, but if you broaden the definition to mean do you have immunity, either through natural infection, through alternative means, or vaccination, then perhaps there could be a discussion if he got the antibodies, for example. But if he's taking some over-the-counter homeopathic medicine, that doesn't give you immunity.
Well, clearly he's not immune because he's now on the COVID-19 list. So we'll talk more about Aaron Rodgers as that plays out with the Packers. But big news from Merck. The Merck pill just approved in Britain as an antiviral pill. So talk about what that means. When would someone take an antiviral pill, and what are they saying it can do?
Huge news. This is important because we've been focusing so much on prevention. This is a treatment strategy. So you would start it at the first sign of symptoms. In fact, it's critical to start it within the first 5 days of symptom onset.
So you have COVID.
You have COVID, you test positive, and you start it. Now they're trying to extend the use of it potentially to include people who may have been exposed to somebody with COVID, almost as a preventive sort of measure, just like we do in HIV. We do post-exposure prophylaxis. It's the same sort of concept. But right now, it's only you test positive, you have symptoms, and then you start this medication within 5 days.
Sounds like Tamiflu to me,
That's
right?
exactly right, or an antibiotic.
Yeah, something like that. But
Yes.
So you really, I mean, first of all, they're asking you to do that anyway. Make sure that you test if you have any symptoms. But then you would right away call and say, get me this.
It's so great, Kim, because I've got patients calling and saying they test positive for COVID, and what do I say? Well, let's wait and see what happens.
Right.
But now we have something that we can actually reach for. And the nice thing about this antiviral is that it probably is going to be resistant to variants because of the way that it works. So what it does is it prevents the virus from making copies of itself after it gets inside you. But it doesn't work through that spike protein, which is really the part of the virus that we're seeing mutate.
Does it fight the symptoms? Does it lessen the impact of having COVID?
So not only does it lessen your chance of ending up in the hospital and having a complication, it reduces the duration of symptoms, so you get better faster. And in fact, it reduces how long you're infectious. So it also helps people around you, such as family members and friends.
That's been so hard for so many folks.
And when might we see it here?
Yeah,
if this is
how
now
soon?
overseas.
November 30th is the day that the FDA
that's sooner than...
Yes. So within a few weeks, perhaps we're going to see it here. But it's important that people don't start thinking that, well, now we've got a treatment, so I don't need to go get that vaccine, or I don't need to get the booster.
That was going to be my question. Is there going to be a fair amount of people that are going to say, okay, this is all I need. I don't need the vaccine.
There are, and that's my biggest worry. These are complementary strategies. One is prevention and one is treatment. It's not the same thing. It's like saying if you prevent cancer, it's the same thing as treating it. Absolutely not. So you still have to get that vaccine, get that booster if you're eligible.
All right, another weapon, though, hopefully in the fight against COVID-19. Thanks, Dr. Kohli. Always good to see you.